Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. I'm sorry, from the front to the back, I should say. And we can see the area of injury, which is down here. This is what we call our Bankart injury here, where that's been peeled off the anterior glenoid. So the capsule's peeled back and the labrum as well. And that's a pretty classic appearance for somebody who's got recurrent anterior instability. You've also got some other findings that confirm it. Here's what we call a Hill-Sachs lesion in the back half of the ball. See, there's the ball there, but back here there's a little area right at the tip of that blue cannula where there's been kind of an impaction injury. So we're going to start the repair in the back with this instrument, which is a RAS, and we're just going to roughen up the capsule back here. Okay, so we've got our first anchor in. You can see the sutures. Okay, and now we're going to take our tools and move the sutures around, because we're going to pass our first stitch here from the back. Watch your hand there. So we're going to reach in here. We're going to take this black and white suture. Okay, you got the camera? You're going to have to... Okay, you can see. Okay. You can see we pass that to ourselves like that. Get this other one out of the way. And next we'll take our turn to the left. I got this for a minute. We'll take our turn to the left suture hook. And we'll show you how we make this stitch in just a second here. Here's the hook. It's loaded with a black wire called a super shuttle. You can see it right there. And we're going to start here. We're going to rotate. We're going to go into the posterior capsule here like that. And then we'll go under this labrum. Okay, there's our first pass. We'll feed that through. We'll show you some more in a little bit. Okay, we've passed the first stitch. Now we're going to do the second one. Cutter next. Record. Record, please. Okay, so we're just freeing up this anterior labrum. This is an important part of the surgery here, just releasing some of the scar tissue so that we can repair this in a better position on the edge of the glenoid here. See how we do that there. Okay, that's looking better. So we'll show you some more in a little bit. Okay, there's anchor number 2. This is in the front of the shoulder, so we're going to start by taking out one of these out of the back, just like that. And we'll keep working to close down that hole right there. Recording. Okay, so let me clear the picture up a little bit for us. You can see here that we've got that first stitch tied. That looks good. We're going to place another anchor. It's going to go right about here. So we'll show you when that's done in just a minute. Pause. Put the shaver in the back. Okay, we're done. We're looking down the front. We've placed 3 anchors in the front. Remember that hole you had at the beginning? That's completely covered up, and we've got the labrum repaired, and I'm happy with the way that looks. We're just kind of polishing things up here so we can get a good final look here. And I'm happy with the way that looks. So okay, we're behind the biceps. There we are in front of the biceps. We can look down the back of the shoulder. That still looks good. The ball looks centered over the socket. We're going to finish up here and get you back to the recovery room. I really hope this does the trick for you, okay? Bye-bye.